There we go. Got the camera rolling there. What's up, guys? Dr. Boyd. Good to see you here today. So I had a post that I put up earlier in the week, just the other day, and it was the ask was simply, what is it you guys want to learn about? Like what can I do to deliver like good information to you? And so I put together kind of a summary of what was asked. So one of the questions that was asked was to talk about heart disease and we'll talk about testosterone. I said, you know what? What about put this together? What about testosterone and heart disease? Like, what does that look like for a guy? So first, let's go to mini med school, okay? So the mini med school side of this, you have to understand what heart disease is, like how it comes about in the first place. I want you to consider something. Consider that from the time that we are born, from the time we're born, we actually start making these atherosclerotic plaques. And what these plaques are is basically like if you were to consider, I'll give you an example. Let's see if I can find something to use in it here. We'll use this cup as an example, okay? So the inside of your arteries, if we were to cut the arteries like that and zoom in, it would be like this, right? So what happens is basically from the time that we're a baby, we start making this plaque that occurs. Imagine almost like butter that starts forming on the inside all the way around the arteries and everything. And as this occurs, this process happens millions and millions and millions of times. And it happens in basically all of our arteries that we have. And so as that occurs, it basically will slowly cause the diameter of the arteries to shrink down. Slowly, this starts to narrow. The pipe starts to narrow a bit. And the reason why this is problematic is this happens in all the arteries, including the arteries that deliver blood to the heart, the coronary arteries themselves. It also occurs arteries that deliver blood to the brain, so our carotids on both sides. Usually, most guys don't even notice it until it starts causing problems with blood flow that's delivering blood to the penis. And so erectile dysfunction can actually be a sign of heart disease all of a sudden. So like all of a sudden, it's like guys are like, I'm not worried about it. So you got to die of something, everything. But as soon as erectile dysfunction shows up, they're like, oh shit, I got to do something. This is meant for you. Like this is us, right? So that being said, so it's like, okay, what can we do to interrupt this process, right? I should say with a caveat, there's some people that make more cholesterol naturally more than others. I'm one of them. So just genetically, I make more cholesterol. I can go like totally vegan. My cholesterol levels are still going to be higher. We make it from our liver. It comes from the food that we eat. And there's some folks that just make more. You may be like me. What can you do to interrupt the process? Be as fit as possible. No cholesterol that's an impossibility. We actually need some level of cholesterol in our body in order to make cells, like outside of our cells are actually made from cholesterol. So you need some around. So the whole idea of no cholesterol is absolutely ludicrous. However, having a low level of cholesterol will actually decrease this plaquing mechanism from happening. Decreasing body fat is one of the ways so that you have less overall cholesterol floating around. And it's one of the ways to just be healthy overall. So let's swing this in the other direction and talk about testosterone. Testosterone, as men age, part of the normal aging process is for our testosterone to slowly diminish. This is one of the reasons why men in their 90s have testosterone levels like in the 200s or so. But here's the crazy thing. I'm 44. If you're anything like me, if you're like late 30s, 40s, something like that, your testosterone very well may be low. About 38% of men have low testosterone. Why? Likely because we've all been eating out of BPA plastics for years. If you're like me and grew up eating out of a lot of canned foods and things like that, testicular injury, all those things can actually lead to low testosterone. So let's put these two things together. If you have high cholesterol and low testosterone together, this is a pretty bad recipe for heart disease, is basically what comes about. So one of the ways to help protect yourself from heart disease and to decrease that process is to get really fit. And one of the ways to get really fit is to safely boost testosterone so that you decrease body fat, increase muscle mass. In guys that are really overweight, which I've been there, guys. I've struggled for a period of time before I created Alpha One Protocol. I struggled with my weight throughout my life. For guys that are overweight, one of the best ways to actually lose weight, providing you fit in the criteria to have that to use it, which I'll talk about that in a sec, is actually to boost your testosterone numbers. You boost your testosterone numbers, then all of a sudden the workouts that you're doing, you're seeing more results. You're actually putting in less effort and getting more results, which is awesome because that's the exact opposite of the aging process. So I said a moment ago, well, what about, are you a good candidate for testosterone or not? I'm going to first say this. If you have a first degree relative that has prostate cancer, so if you have either your father or your brother that has prostate cancer, you're not a good candidate for testosterone, period. And any doctor that tells you otherwise, it's not accurate. And the reason why, just because a man goes on testosterone therapy doesn't guarantee that he will get prostate cancer. However, if someone has a genetic predisposition to prostate cancer, and we usually don't know, like there's not a way to tell, then if you could go on testosterone replacement therapy, that's like throwing gas on the fire. Second thing is blood disorders. Some folks who have that's pretty rare, but if they have like a concentrated blood disorder, things like that, going on testosterone therapy can actually raise your number of red blood cells and put some folks, very few amount, but it can put some folks at a higher risk of developing blood clots. This is the reason why labs have to be watched really, really closely, why you don't go to a place that's giving you testosterone just haphazardly. It needs to be watched closely. It really needs to be doctor supervised. I hope that sums up some things there for you. Listen, Alpha One Protocol is not like any other program that's out there. I designed this intentionally to be a no-brainer, to have so much value to it that any guy that would walk down this road would be like, what? This is like a ridiculous value. Of course I want to do this. It's the only program that combines health, hormones, and habits. Health, so diet and exercise. And when I say diet and exercise, I don't mean go on a diet. I mean an actual program that is foolproof, that is easy, that all you have to do it and it's lifelong. So that's number one. There's accountability. It's there. You follow it along in the app. You have one-on-one communication. You're actually competing with the other brothers in Alpha One Protocol. It's easy. It's as easy as it can ever be made. That's number one. Hormones. Hormones are self-explanatory. So actual blood tests to see where you're at, what the hormone levels, and all of the correlating things that could go wrong. So PSA, looking at your blood count, your growth hormone levels, so forth and so on, so we can make sure that everything looks appropriate. Health, hormones, and habits. One of the biggest problems that we have, guys, is that we will fall into habits that don't serve us. Power is nothing without control. Finding that self-control, finding those habits that serve us best is really where it all comes to play. That's really where the rubber meets the road. And that's what Alpha One Protocol is all about. So that's the final component, is the elite level men's coaching portion that comes with this, where there's accountability, where there's actually sharing these same issues that you and I are having that we think are singular to us, but they actually happen with other men as well. And here's the thing is, the more high power the man, the more we pull ourselves away, the more we think that, you know what, this is only happening to me. The stressors of whatever your business is, the stressors that come along with being either a husband or having a significant other or children and managing your business, and at the same time trying to operate at the highest level and even get to the next level. That's what Alpha One Protocol is all about. So if you've been sitting on the sidelines, I know you're hearing Alpha One Secrets, and I love you guys for being here. And I want to put that value out there to you, even if you never join Alpha One Protocol. But if you're at that place in your life right now, if you're a man and you're like, you know what, man, I want to get to the next level. My energy, I feel it. The things that I was doing before for my energy, the coffee's not working anymore. The Mountain Dew's not working anymore. I want to get to the next level. Here's your answer. If you're like, man, you know what, like I feel like maybe if I just had a doctor that understood, that could take care of of the men's side of my health, I could talk to about men's health. Here's your opportunity. Maybe if I just got to the point where physically I could finally shred the weight, where I could finally feel powerful, where I could finally have that confidence, and understanding what that confidence then brings to your business. When you have more confidence, you make more money. It's not rocket science. When you have more confidence, you show up more for your wife and your children. It's obvious. When you have more confidence, you feel better about yourself. And guess what? You create more things in your life and you create more things of value in your life. You live a better life. These are facts. So if this is resonating with you, raise your hand. I'll shoot you a direct message. Put them below. Raise your hand. I'll shoot you a direct message. You and I'll have a conversation. We'll see if you're a fit for this or not. Because there's no coincidence that you're here. You came into this group because you were looking for something more. Gentlemen, here it is. That's what I got for you today, my friends. Remember, health is wealth. Invest in yourself. Love you guys. Thank you for being here. And more topics that you want me to talk about, put it in the chat below. Would love to hear your comments. See you guys. Have a fantastic week. Bye.